I'm Dr. Autumn Morales here at Clarinda Regional Health Center, and I wanted to talk to you today a little bit about well child visits. This time of year we're starting to already think about back to school, and a lot of families, that's when we also think about checkups. And if you didn't know, it is recommended that all kids ages 3 through 18 have a yearly checkup, whether they need shots or not. Of course, babies need more often checkups, but those 3 and up, once a year. And there are immunizations needed at 4 to 6 and at age 11 to 12. So a lot of those times you're going to be in here just for shots, but we also want to encourage just regular well child checks. One thing that we are also finding is that a lot of folks don't realize what a well child check involves. And really what that is it's an extensive review of your child's entire health history. What we look at is health habits like brushing your teeth. We look at vision. We look at your diet. We look at development, school, and not just things like grades, but we also talk about how are they getting along with their teachers, how are they getting along with their peers, and are they having things like bullying. And a lot of times that's when those things come out for families, and it's a really important time. We also talk about age-appropriate anticipatory guidance, and that means things like drugs and alcohol for teenagers. It can mean bullying for middle school kids. It can be things like sunscreen and other things like that that can be safety issues. And we do go over other safety things like when does a child need to be in certain car seats versus a booster seat. And a lot of families, that's the time that we say, now you have this semi-permission to flip your child forward or to switch to a regular booster from a 5-point harness. And that's a great time for us to talk about those sort of things. We also do immunizations at well child visits, and that's just included as part of the checkup. We also can talk about their chronic diseases, things like asthma, ADHD, or any other chronic problem that your child may have. Again, that would all be included in this one checkup as an extensive, full physical, full history for your child. A sports physical, on the other hand, is a very quick visit. It just involves a quick review of sports-related injuries and any kind of history that might warrant a child not being able to play sports, such as a heart history or a family history of some heart problems, specific heart problems, not just every heart problem. And then we do a quick exam. A sports physical does not include immunizations. We won't refill medicines. We can't do other things like that because just a simple sports physical is really not meant to be the full well child check. That being said, during your well child check, we are happy to fill out your sports physical form because we've already done that complete assessment. That doesn't just go for sports physical forms. A lot of times I'll do camp physical forms or forms for summer jobs, things like that that are also important, or daycare forms. And we consider that part of your checkup. It's not an extra fee, it's just what we do as part of a regular good old checkup. I hope that gives you a little bit of information as far as what is involved in a well child check, and also whether or not you want to choose a well child check versus a sports physical. As a pediatrician, I definitely recommend a well child check. Doesn't mean we don't do sports physicals, but I want every parent to really think about, has my child had their yearly checkup? And if not, I would encourage you to call your provider and schedule an appointment today. Thanks, and have a great day.